Hi, this is Callum. So this is the first in a series of videos where we're going to look at the urinary system. This is a bladder biopsy. Um, this is the main type of specimen you will encounter bladder. Biopsies are very common for diagnosis and surveillance. However, full resections of the bladder is a very uncommon outcome, even for patients with bladder cancer, because the majority of those cases are caught at an early stage and are amenable to transurethral resection, whereas a full bladder excision is a bad outcome and is reserved for patients with more advanced disease. So this is a bladder biopsy. This is normal bladder mucosa. So the whole urinary tract will have a broadly similar, follows this kind of similar appearance. Within the bladder, it really has two functions. So it protects forms protection from urine, which is highly concentrated and hypertonic. So it would have a tendency to draw water from the cells. So we need to protect the cells of the wall of the bladder from that, and the urothelium, the outer urothelium, that provides that role. And the second function is really obviously the bladder, the urinary bladder, to give it its full name, is basically a container and needs to be flexible and distensible. That is to say, it can expand so that it can hold a large volume of urine. So it has those two roles. And if we look at the structure of it, that will explain how it performs these functions. So here we've got a biopsy of bladder. The outer epithelium here is a special type of epithelium which lines the entire urinary tract, and it is known as urothelium or transitional epithelium. It's got those two names which are synonymous. It may look broadly similar at first glance to some of the other squamous epithelium that we've looked at in other parts of the body, and it does have a lot of similarities. So it's a stratified form of epithelium. We've got a basement membrane down here along the bottom, and then a stratified epithelium above it in multiple layers, but then at the surface is lined by these slightly different cells, these bigger cells. These are called umbrella cells. So under normal conditions, I mentioned that this was stratified. Usually it would have 3 to 6 layers under normal conditions. There can be a bit of variation in that. That's including the basal and the layer of umbrella cells on the surface. And that the variation between 3 to 6 reflects its distensible nature. So if it's in its stretched position, it will be thinner, and if it's in its contracted position when it was fixed in formalin, it will be thicker. So I would say we've maybe it's maybe approximately about 6 layers thick here. 1, 2, 3, 4, 5, 6, or thereabouts. It can be slightly more under normal conditions, but we just nominally say it's between 3 and 6. So basement membrane, basal layer. This is where the basal layer is where the kind of the stem cells replicate and mature to give the rest of the remaining layers. You've got your kind of intermediate layer where it looks a bit jumbled up. These are all just transitional epithelial cells. And then along the surface, there's a special modified type of cell, which you don't see in other stratified epithelia. We just see in urothelium or transitional epithelium. And this is a layer of umbrella cells where they've got more cytoplasm, more pink, indistinct, almost fluffy looking cytoplasm, and it lines the surface. And these are the cells that are really important in urothelium for forming that protective barrier against the urine. It's normal to see this kind of slightly undulating surface here. We've got a bit of a cleft here, and that reflects the fact that the bladder, in its relaxed state, you can see a bit more sort of undulating here over the surface. In its relaxed state, it sort of concertinas up, and then in its distended state, when it's full of urine, it has the ability to stretch out without compromising that protective barrier. So urothelium on the surface, and then underlying that, we've got connective tissue, and it's quite highly vascular, lots of little blood vessels, scattered small lymphocytes, which is a normal finding. At this degree of lymphocytes is a normal finding. It can be quite chronically inflamed within the bladder often, but this is probably normal. So connective tissue, blood vessels, some chronic inflammatory cells, and that's normal, and that's the lamina propria of the bladder. And then there's this other structure, is the other main structure within the bladder wall, and this is smooth muscle, and that's the smooth muscle of the detrusor muscle. I think if we zoom over, scoot over here rather, we can see that in a better arrangement. So you've got urothelium over the surface, underlying that lamina propria, connective tissue, and underlying this big, thick bands of smooth muscle, and that's the detrusor muscle. And we know it's smooth muscle because these are cells with cigar-shaped nuclei, abundant pink cytoplasm arranged in fascicles. And the nuclei are in the middle of the cell. They're not arranged on the outside. They've not got the cross striations that you see in skeletal muscle, and skeletal muscle has no business being in the wall of the bladder anyway. So smooth muscle of the bladder wall, that's the detrusor muscle. And that becomes important later on when you're dealing with biopsies with bladder cancer in it, or urothelial carcinoma in it, because if it invades into the detrusor muscle, that has an effect. That has important implications for staging, upstages it. So that's really all there is to say about this. I'll just mention the nomenclature. So this is called urothelium or transitional epithelium, and that's reflected in the names of when it becomes malignant. It can either be called urothelial carcinoma or transitional cell carcinoma, or TCC for short. TCC has been the name you'll see in clinical parlance. It's been used for a long time. I think the convention now is moving towards urothelial carcinoma, but you'll hear both of those names, and they're synonymous. Okay, great. I'll move on to the next video. Hopefully join you then. So speak to you soon.